Hello, these are the parts of Chapter 4, focusing on physical development and health in infants and toddlers that will help you complete your module assignment number 1. So for 9 months, we're waiting for a baby to arrive, and we're excited for them to be here. And once they get here, sometimes it's frustrating because they spend a lot of time sleeping. And part of that is that human babies are not fully developed enough to cope with waking life, and they need some time to sleep and catch up to the level of development they need to cope with what they need to being awake more hours in the day. So there are different states of arousal and duration in newborns. So we have different arousal states. We have regular non-REM speech that happens about 9 hours per day. And you have some behavior and physiology in relationship to that. So there's low body activity, the eyes are closed and still, breathing is slow and regular. Then we have 9 hours of REM sleep with slow movements of the limbs and body. They may scrunch up their face and smile. Their eyes are closed, but occasionally there's rapid movement or movement under the eyelids, and their breathing tends to be fast and irregular. Then waking activity and crying is only about 2.5 hours per day, where they're participating in kind of sometimes vigorous motor activity, but otherwise maybe spurts of that. They vocalize and make facial expressions. Their skin can be flushed and reddish, especially when they're crying, and they may not be as responsive as we would like them to be with stimulus. Then they have a state of quiet alertness, 2.5 hours per day, with slight body activity, relaxed face and eyes are open and bright. This time is when they're responsive to external stimulus. Their breathing is regular, but faster than non-REM, but not faster than REM sleep. And then 1 hour of drowsiness, where they're less active than in REM sleep, but more active than in non-REM sleep. Their eyes are open, but they may be kind of staring off into space, and their breathing is faster than non-REM sleep. So you can see there's a lot of different types of sleeping going on in newborns. And so here it shows you the duration of crying and fussing during this time, and it starts at 3 weeks and goes up until 12 weeks. And you can see that the highest level of crying tends to be 6 weeks, and then it diminishes as they get older. So co-sleeping, or sleeping with or around parents, the infant shares a bed with one or both parents, and longitudinal or studies over time shows that co-sleeping is safe if we take precautions. If the infant is sleeping on a cot next to the bed and they're lying on a hard mattress like this infant is, and we avoid using blankets or loose sheets to cover them. We don't use bumper pads, and stuffed animals or dolls are not in the bed. So we want to just have a sheet covering the mattress and the baby inside the bed. So sudden infant death syndrome, or SIDS, is a syndrome where an infant dies in the first year of life, but it can happen up to ages 3 or 4. Exact causes of SIDS are unknown. That's why it's called a syndrome. But contributing factors might be neural control of breathing, or neurons in the brain, or exposure to stressors that impact their breathing. And so another definition is it's a condition that occurs when infants stop breathing, usually during the night, and die suddenly without an apparent cause. SIDS remains the highest cause of infant death in the United States, with nearly 3,000 infants dying every year attributed to SIDS. The risk of SIDS is highest at 2 to 4 months of age. T-Berry Brazelton, which is a Harvard pediatrician, says that when children transition from one stage of development to another, when they're in those transitional periods, they're more at risk for being affected by SIDS. Some other related factors are low birth weight babies, and these are babies that are full term but are small for their age. They're 5 to 10 times more likely to die of SIDS than are their normal weight counterparts. Infants who have siblings who died from SIDS are 2 to 4 times more likely to die of it. African American and Eskimo infants are 4 to 6 times more likely to die of SIDS. It's more common in lower socioeconomic groups, and two recent reviews concluded that breastfeeding is linked to lower incidence of SIDS. And then one way that we've discovered that we can prevent SIDS, what's related to, is to put infants to sleep on their back. That's called the Back to Sleep campaign. Not on their side, not on their belly, but lying them down to sleep on their back. And so here you can see that this is a graph of the U.S. SIDS rate and sleep position between 1988 and 2010. The largest decline in SIDS rates occurred between 1992 and 1999. Between 1994, when the Safe to Sleep campaign, formerly known as the Back to Sleep campaign, started, and 1999, the overall SIDS rate in the U.S. dropped by more than 50%. And during the same time period, the rates of back sleeping more than doubled. And so you can see that in the graph. So now let's move to feeding infants. Breastfeeding is recommended as exclusive food only for the first 6 months. After 6 months, you can introduce solid food, starting with cereal and then vegetables. You want to start with vegetables versus fruit because fruit is sweet and they're less likely to accept vegetables once they've gotten used to the fruit. And wait for introducing meat, and be aware of allergies. Likely allergies for infants would be to oranges, strawberries, and eggs. And never give an infant honey until they're 12 months old, because there is a spore in honey that their system can't deal with. Breastfeeding should continue through 12 months. Part of the reason we wait until 6 months to introduce solid food is they're not able to swallow solid food well, and we want to avoid putting cereal in formula in a bottle because they're more likely to choke. That's something to keep in mind. So if we wait till 6 months, the infant is much more able physiologically to swallow the food, and their digestive tract is better able to handle the requirements to digest that food. So the benefits of breastfeeding, short-term benefits for the child would be fewer infections because mother can pass on their immunities, less intestinal disease. There's a possible link to lower rates of childhood obesity and lower likelihood of SIDS. And then long-term benefits for the child is there's an increase in IQ scores. Outcomes for mother, lower incidence of breast cancer, reduction in ovarian cancer, and type 2 diabetes. So now let's take a look at motor development. Motor skills reflect interactions between the brain and body development, specific experiences, and cultural practices. So in the beginning, reflexes are our body movements or motor skills revolve around reflexes, and these are fixed motor actions that always occur in response to a specific stimuli, so they're automatic. So survival reflexes include breathing, in an infant rooting, which would mean looking for a source of food. If you touch their lips or chin, they're going to turn towards the direction of where they've been touched, and they'll stick out their tongue to suck and swallow. Also, eye blinking is a survival reflex to protect your sight. Primitive reflexes are protection devices, such as grasping. If they fall, they're going to grab on. A startle reflex is if they're surprised, they're going to move their arms up and their legs out and flail or spread their fingers and toes. And they also have a reflex for removing items from their face. Reflexes normally disappear during the baby's first year. If retained, reflexes signal that there's some sort of neurological problem. And part of the reason they disappear is that the infant learns to do that. It doesn't need to be automatic anymore. And this is the transition that T. Barry Brazelton was talking about in relationships to SIDS. Sometimes the reflex will disappear, but the infant hasn't learned how to do the reflex on their own, and that would put them at risk for SIDS. So we have our ranges of normal development from the work of Gassel and Bailey, and these are our classic motor development theorists. They studied gross motor movements, or development of large groups of muscles, and fine motor movements, the development of small groups of muscles, and they came up with some ranges of what is typical in regards to that development. And so here you can see age ranges for pushing up their head and chest, about 2 months, rolling from back to side, about 4.5 months, sitting alone steadily, about 6.5 months, pulling to stand up, about 8 months, standing alone, 11 months. And so take a look at this, and in your assignment, you're going to talk about your virtual child and when they accomplish these tasks. And if you don't have an assessment within your virtual child, you can talk about your child in regards to averages. And then here, this is fine motor skills. And so these are different types of grasp, like just touching the block, about 20 weeks, primitive squeeze around that same time, squeeze and grasping about 24 weeks, grasping in their palm about 28 weeks, a four-finger grasp, which is very sophisticated, 52 weeks, and then and the first one is to the side, and the superior one is grasping from the top. And again, you could talk about these averages in regards to your virtual child, for your assignment. So according to dynamic systems theory, infants learn how to how to coordinate body parts to reach and grasp. The ecological theory says that infants use proprioceptive cues, like feedback from their muscles about the location of the arms and hands, to reach and grab objects. So these are just two theoretical perspectives in regards to reaching and grasping. So crawling allows the infants to explore the environment, and walking typically occurs around the first birthday. Before infants walk, they're going to cruise around furniture or places where they can hold on and practice walking. So here, this is an example of cruising. The infant's holding on to cupboards in the kitchen. And here the infant is walking with support. And then finally the infant is engaged in independent walking. So just because they can stand up, they don't automatically walk right away. It's a slow progression into developing that ability. So now let's take a look at brain development. So synaptogenesis is the rapid dendrite and synapse growth in the first 6 months of life. Even though they are growing, the dendrites and synapses, unused synapses are pruned out or removed, so there's more space for other synapses and dendrites to grow. Myelinization occurs rapidly in the first year, and this speeds up neural conduction for faster neural communication between the nerves in the brain. So here's a neuron, and let's look at the parts of this neuron. So this is a dendrite. This branches out like the limbs and twigs of a tree, and this receives signals from other neurons. Here's the nucleus of the neuron, and this contains the chromosomes. Here's the cell body, which contains the nucleus and other parts of the cell that keep the neuron alive. And here's the axon, and this is the fiber that transmits messages from the cell body to other neurons. And here are the synapses, and this is the tiny gap between the dendrites of one neuron and the axon of another. So we have dendrites, axons, and synapses, and then the nucleus and the cell body. And then the myelin sheath is the layer of fatty tissue that surrounds the axon. It kind of looks like Tic Tacs there. And this continues to develop until adolescence. The terminal buttons are at the end of the axon, and this connects to the dendrites of other neurons. And so here, this is an example of the growth of neurons and dendrites, axons, and synapses. And you can see on the left here is a newborn and what the visual cortex looks like at 1 month, 3 months, and 6 months. And our goal is to have it very dense like it is at 6 months. And we can promote that by interacting with the baby, holding the baby, talking to the baby, meeting their needs consistently, providing an enriching environment for the baby. And so here, at regular times, as we mentioned earlier, there's pruning going on. And so you can see soon after birth, there's some pruning going on. Just before puberty, there's some pruning going on. And the pruning goes down after adolescence.